Dr. Chris, and today I'm talking about why Los Angeles Chargers safety Derwin James is out for the 2020 season. This was an unexpected turn of events after his injury and subsequent surgery, so I'm going to explain what is the reason behind this surprise.
Ladies and gentlemen, can I please have your attention?
Hey everybody, Dr. Chris, orthopedic surgeon and sports medicine physician. If you are here because you recently subscribed to my channel, then thank you for becoming a part of the Intern Army. Welcome to my channel where I explain orthopedic injuries and sports medicine in a way that's easy to understand for everybody. For returning members of the Intern Army, welcome back. Thank you for helping me get to 57,000 subscribers, onward and upward to 100,000. Maybe we can make it happen by the end of the year. So let's discuss what's going on with Derwin James. Who is he? What happened? Why did he throw your fantasy football team into a tailspin? And what does this mean for your fantasy football team, the Chargers, and most importantly, for Derwin James? Derwin James Jr. is a strong safety for the Los Angeles Chargers and a cornerstone of the Chargers defense. This Defensive Player of the Year candidate was injured during practice on August 30th of 2020. Unfortunately, this is not the first time that he has dealt with injury, having had issues with his hamstring in 2018 during training camp, and then a stress fracture in his right foot in 2019. After going down on a play during an intra-squad scrimmage, James grabbed the back of his right leg and then walked off the practice field. He immediately went to the medical tent and did not return to the practice. He was initially believed to have suffered a hamstring injury of unknown severity. However, the following day, Ian Rappaport reported that he had suffered a meniscus tear and was expected to undergo surgery and miss significant time during the upcoming season. Several days later, on September the 2nd, James was placed on season-ending injury reserve after having undergone meniscus repair during surgery. So what's the deal with the surgery he had, and why is he out for the season? James apparently suffered a meniscal injury after he went down during the scrimmage. The meniscus is a kidney bean or crescent-shaped piece of fibrocartilage that lives in the knee. There are usually two of these structures in each knee, one on each side of the knee. They have a number of roles inside the knee that include shock absorption, structural stability of the knee, and friction dispersion through weight distribution across the joint. The meniscuses, or menisci, are partially vascular structures, meaning that they directly receive blood flow from nearby blood vessels to part of their structure. More on why that is important to the James return to play timeline later. The meniscus can be injured when an athlete pivots on his knee, when the knee is forced into a significant amount of flexion or bending, or when the athlete suffers a ligament injury to the knee. There are a number of ways in which the meniscus can be injured, but the most problematic injuries are meniscal tears, both acute and chronic. Of these, acute tears are generally the most problematic. There are several types of acute meniscal tears that are distinguished by the pattern of tearing. Some of these are simple, others are more complex. The size, location, and the complexity of the tear are all important factors in determining its treatment. Small, simple tears are more amenable to repair, while larger, more complex tears are less likely to be repairable. Given that the meniscus has three zones, each with a different level of blood supply, it is not surprising that tears that occur in well-vascularized areas, the red zone, are more amenable to repair, while tears that occur in less vascularized areas, the white zone, are less likely to be repaired. So, knowing all of this, what can we determine from the information that has been provided? James underwent a right knee arthroscopy and is expected to miss the entire 2020 to 2021 NFL season. Normally, with a knee arthroscopy, we are accustomed to the athlete returning to competition within a 4 to 6 week time frame. So why the extended absence here? As mentioned previously, treatment of meniscus tears is determined by a number of factors. Quite frequently, meniscal tears are complex and located in poorly vascularized areas of the meniscus. These tears are less amenable to repair as their healing potential is poor. These types of tear are typically treated with a partial menisectomy or resection, where a portion of the meniscus is removed with arthroscopic instruments. The remainder of the meniscus is left intact. Rehabilitation and physical therapy can begin immediately after surgery, and the recovery from surgery is fairly rapid. Most athletes can return to training within 4 to 6 weeks of surgery. The timeline for a return to sport is short, and usually there is a limited effect on the athlete's performance upon return. On the other hand, there are tears that are relatively simple in nature with only a single or few cleavage planes through which the tear runs. If these tears occur in a zone of the meniscus that receives abundant blood supply, then they are more amenable to repair. Using a variety of methods, the meniscus is basically sewn back together and secured to the capsule of the joint, or in the cases of the meniscal roots, to the bone of the tibial plateau using arthroscopic instruments. A repair leaves the entire meniscus intact. However, healing of the meniscus tissue requires time, during which rehabilitation and physical therapy must be restricted to avoid tension on the repaired meniscus that might damage the repair or loosen the sutures of the repair. Consequently, the repair must be protected for 6 to 8 weeks before intentional rehabilitation can even begin. Already, this is more time than with the partial meniscus resection. Once rehabilitation has started, it will take another 6 to 8 weeks for the athlete to attain full range of motion and functional strength. At this point, we are already 3 months into recovery following the meniscus repair. While the athlete may be able to return to competition at this time, it is likely that he will still require additional rehabilitation and training to return to competition. So with the repair, the timeline for a return to sport is much longer, and if the athlete returns to competition before rehabilitation is complete and baseline performance has been returned, there may be an impact on the athlete's performance once competition has resumed. So why would an athlete or his physician choose a repair over a partial meniscus resection? In terms of your fantasy football league, it is better for you if James undergoes a partial meniscectomy and is able to rehabilitate quickly and return to competition by mid-season. And certainly, if this is good for you, then it is also good for the Chargers. James is back on the field in a relatively short period of time, bringing his hard-hitting play to the defensive backfield. However, what is good for the goose is not necessarily good for the gander. While a partial meniscectomy will get James back on the field quicker, the long-term effects of a partial meniscectomy are less favorable for James than are the long-term effects of a meniscal repair. Rapid cartilage wear after lateral meniscectomy has been reported, especially in professional athletes. In professional athletes who practice impact sports, partial lateral meniscectomy should be avoided whenever possible. Meniscus repair is the treatment of choice for this population, and most athletes are able to return to sport between 4 to 6 months after repair, although a delay of 6 months is optimal. While there is a failure rate of up to 25% for meniscus repairs, the rate of cartilage damage in the face of partial resection is higher and results in worse outcomes for the athlete. This is the likely scenario for James. He probably suffered a relatively simple meniscus tear that occurred in an area with good blood supply, and his physician performed a meniscal repair to preserve his meniscus and to minimize long-term negative effects on his cartilage. If all goes well, we can expect that James will be fully healed and rehabilitated within 6 months. He will be able to train normally during the off-season and return to regular play in the 2021-22 season. So if anyone asks, that is the reason why Derwin James is out for the season. Now you know. So the Coles Note version is this. He hurt his knee and he injured his meniscus. He had surgery. If they repair the meniscus, he is less likely to have arthritis and more likely to have better long-term outcomes than if he had had a partial meniscectomy. But the repair takes longer to heal, and your fantasy football team is going to be the worse for it. Support what I do. Join the channel on my Patreon. I'll see you on the next one. Thanks for watching. And as always, that's been a word from Dr. Chris, not your everyday ortho.
Just a flesh wound.